Guten Tag, Internet and YouTube. Welcome on my YouTube channel. In this channel, I want to try to educate people on radiology. I thought to myself that the majority of people, if they get a CT or MRI or X-ray, they never actually see the scans by their own. They only get the results through a third party like the family doctor. So therefore, I would like to provide a service with video analysis and demonstrate the anatomical structures on the scans and outline the pathology so you can see it with your own eyes and maybe understand the pathology much better or understand the disease better. And if you like, I can do this also with your private scans. You can contact me via email if you have interest in that. So let's start with this CT. This is a CT of a 33-year-old patient. The patient came to the ambulance with the heavily shortness of breath. He was overweight, about 170 kilos by a height of 190 centimeters. And the primary clinical diagnosis was a pulmonary embolism. So here we have the CT. Here's the right side of the patient. That's the left side of the patient. Here we have the upper side of the patient. And here is his back side on which he is lying. The CT appears in black and white, which is representing the different density of the anatomical structure. So black is representing the lowest density and white is representing the highest density. For example, here we have the skin, and under the skin is the fatty tissue, and the fatty tissue um, always appears dark and almost black is because the density of the fat is very low, and only lower is the air, in which we see here in the lungs. Here is the right lung and here is the left lung, and also in the air tube, this one, this round small structure, this is the air tube, and within is also air, and that's why it's dark. Right here we see the muscles, and the muscles are much more dense than the fatty tissue. That's why they appear much brighter. And the brightest what we have, these are the bones on the CT, which you can see here everywhere. These are like the ribs, and they are the brightest part. Also what is bright in the CT is here the blood vessels. This is because we we gave the patients some contrast agent which is coming through the right arm. You can see it clearly here. This is the contrast agent which is applied under pressure into the patient's right arm. So it's coming to this big vein. You can see here, this is this big vein, and it's called superior vena cava, and then from here is going to the heart. I will show you here. So this is the heart, and this you could see this is the superior vena cava, and it's making his end this entry here in the right atrium, and then in the right ventricle, and from there it's going to the truncus pulmonalis, which is this structure here, and then it's this is already a blood vessel which is then dividing to the pulmonary arteries, the right one and the left one. So here truncus pulmonalis, the right pulmonary artery, and the left one. And here you can already see the pulmonary embolism. You see here a lot of dark parts which are within the vessels, and these are blood clots. I will mark them for you so you will know exactly what I'm talking about. So for instance, this one here, also this one here, and there are much more of them. We go forward, we see here is another one, here is another one. So these are all things which normally are not seen on the CT. I will delete these things. So here we already have the diagnosis for this patient, and for sure he will get a therapy. This therapy will be an anticoagulation therapy, and these blood clots, they are causing a blockage of the bloodstream, as you can imagine, and therefore the oxygen exchange in the lung is reduced, and that's why the patient has so much struggle to breathe and gets enough of air. The auxiliary finding in this CT is in the gallbladder. Here we are now in the abdomen. Here is the liver. Here is the spleen. Here are parts of the stomach. And if I go more down, you can see here, this is the gallbladder. One more time, I will mark it for you. This all is like the gallbladder. And in this gallbladder, you see some round and bright structure. These are gall stones. Most people with gallstones, like 80%, they have never symptoms. Also in this patient, he doesn't have any symptoms from them. Most probably these are mixed stones. They typically contain 20 to 80% cholesterol. You can see here in the center that is it's like very dark, like the fatty tissue, and it's like the cholesterol. And on the outside, the common constituents are calcium or carbonate, like in the bones. That's why they are so bright on the outside. So actually, that's all from my side for this presentation. If you wish that I make a video analysis or CT or MRI or X-ray, please don't hesitate and contact me. Till then, take care and auf Wiedersehen.